The Tasmanian Labor Party has drawn a line in the sand ahead of next weekend's snap election, unveiling a bold healthcare promise that could reshape the way everyday Tasmanians access basic medical care. In a political climate where trust in public services is fragile and voters are demanding more than empty slogans, Labor's renewed commitment to free GP access is more than a campaign pitch, it's a declaration of intent. Where once there were 5 government-run GP clinics proposed, now there will be 10. A doubling of commitment, a doubling of access, a doubling of hope. Labor isn't merely talking about health care, they're pointing to the front lines. To emergency departments bursting at the seams. To families waiting weeks for basic appointments. To pensioners choosing between a doctor visit and a grocery run. To regional Tasmanians who feel forgotten again and again. And in that landscape of strain, they're planting something solid. 10 clinics, government-run, community-focused, strategically placed in health hubs across Tasmania. Designed not just to treat, but to relieve pressure, to restore dignity, to offer help before health spirals into crisis. This promise isn't plucked from thin air. It draws its lineage from the successful rollout of urgent care clinics, initiatives driven by collaboration between federal and state governments. Clinics that took pressure off hospitals. Clinics that caught problems before they worsened. Clinics that made people feel seen. Tasmanian Labor is not trying to reinvent the wheel. They are learning from what works and scaling it to meet the needs of their own. And it's not just about bricks and mortar, it's about trust. About telling the nurse working overtime in Launceston that help is on the way. About telling the mother in Glenorchy juggling 3 jobs that her child can see a doctor without a bill. About telling the retiree in Burnie that he no longer needs to queue for hours or delay care until things get worse. The plan, if realized, would mean thousands of GP appointments delivered at no cost to patients. That's more early diagnoses. That's more flu shots before winter bites. That's more mental health check-ins before the darkness grows too thick. This isn't just healthcare infrastructure, it's prevention. It's early intervention. It's cost-effective governance. It's also a message to Canberra that Tasmania refuses to be the forgotten state. Because if Canberra can deliver urgent care clinics to the mainland, if other premiers can stand beside bulk billing as a right, then why not Tasmania? Why not now? The opposition will ask where the money's coming from. They'll question feasibility, staffing, long-term viability. Labor says it's time to stop asking why we can't, and start asking why we haven't already. They point to the $5 million already earmarked under their existing plan. They suggest this new expansion will be fully costed, that funds will be drawn from the same pool that governments already use to support under-resourced hospital departments. They're not asking for faith. They're asking voters to judge them by delivery. This new policy, Labor says, is about cutting the cost of living in the most direct way possible, by removing the invisible fee of delayed care. Because when people can't see a GP, they end up in the ER. And when they end up in the ER, it costs the system 10 times more. So this promise is not just compassionate, it's economic common sense. And it's a challenge to the Liberals. Where is their plan? Where are their clinics? Where is their vision? Labor is betting that the electorate is done with the waiting, done with the excuses. They want to stand up on day one, look Tasmanians in the eye, and say, here is your clinic. Here is your doctor. Here is your care. From the Derwent Valley to Devonport, they want every Tasmanian to know that their health is not a political football. It's a right, but beyond policy documents and press releases, this is also a moral stand. It says, in a state where ambulance ramping has become the norm, we won't wait for another tragedy before acting. It says, we're listening to nurses who say they're burnt out, to GPs who say they're overwhelmed, to families who say they've given up trying to book. It says, we're not just making this promise to win votes, we're making it to change lives. The policy, if enacted, would see clinics embedded in existing health hubs, offering after-hours access and walk-in appointments, particularly for vulnerable communities. It would be rolled out over the term of government, prioritizing areas with GP shortages and longer wait times. The clinics will work alongside, not in place of, existing services. They'll link in with hospitals, mental health support, and allied health networks. They'll become pillars in a more integrated system. Labor knows this isn't a silver bullet, but they believe it's a solid first step. They're promising a task force to oversee implementation, community consultation to ensure local voices shape each clinic's design, and a clear accountability structure to track performance. Because they know voters aren't interested in empty gestures, they want results. This policy is also personal for many candidates. Some have told stories of waiting weeks for a GP when their child was sick. Others have spoken about watching elderly parents suffer in silence because of cost. It's not abstract, it's lived, and that's what Labor is trying to tap into. Not politics, but people. They are drawing a map to a future where Tasmanians don't need luck to access care. Where geography or income doesn't dictate whether a lump gets checked, or a cough turns deadly. Where government steps in not when it's too late, but just in time. This is not about headlines. It's about families. It's about the new parent who just wants reassurance. The teenager struggling silently. The grandparent who's stopped complaining because they're tired of waiting. Labor says this election is their chance to change all that. To replace fear with access. To replace silence with service. To replace decline with dignity. The campaign trail will go on. Ads will run. Debates will rage. But somewhere in the midst of it all, someone just needs to see a doctor. And if Labor wins, they're saying that doctor will be waiting, with no bill, no delay, no questions asked. Because health isn't optional, it's the foundation, and they're ready to build on it, 10 clinics at a time.